Well, thank you for coming to the town hall meeting for the fall quarter. I'm Dr. Meyerfoefer. For those who haven't met me, I took Dr. Kelly's place. That's usually the easiest way to explain who I am. So I'm a surgeon by training, so I tend to talk fast. So I'll try and slow down. Start with an eye care standard. R stands for respect. Be timely in your service. Treat everyone fairly. Greet everyone as you pass them in the hall. And what does respect mean to you in your job? I've been telling people that I've been in many different organizations, and I've been very pleasantly surprised here at a small organization. People are very friendly. They greet you in the hall. I'm terrible with names. Unfortunately, a lot of people know me but don't necessarily, I can't remember their names, but it's just very nice that everybody greets everybody and greets them with a smile. So it's a good thing. Start out with some awards. We received the Leapfrog Award for our patient safety in 2014. We got an A. They grade you A through F. Bruce handed out the listing throughout the whole state. There were a few A's, B's and C's, a couple D's. There was one F. I would not want to be on the staff at a hospital that had an F. So it's good that we have an A, and it's something that we are proud of and we want to continue to do to make sure that we have good patient safety. Home care was named to the top 500 out of 9,000 different agencies based upon their performance. So it's a good thing that we have good home care. As we go through different changes in the way healthcare is provided, it's important that we be able to take care of people across the whole continuum. And so having home care will make sure that the patients are getting what they need, so it potentially decreases our risks of readmissions. Our stroke care has been designated by the American Heart Association, the American Stroke Association as Silver Plus. That's an upgrade from the bronze that we started out with. It's more of a time thing. We've only had our stroke program going for a relatively short period of time. So to go from bronze to Silver Plus is very good. Eventually we would like to continue to move up the scale as we continue to provide excellent stroke care. We also received from the advisory board their 2014 Excellence in Engagement Award, and it recognizes that we have a high number of engaged employees compared to the employees that are disengaged. And so we were in the top 20 hospitals nationally. So that's a good thing, because when your employees are engaged and you don't have many employees that aren't engaged, it means that they're actively working to improve the facility. If you've come to other meetings, you know about the core measures. We look all the way back to the fourth quarter of 2012, and then this is the most recent quarter that we have data for. This is the number that we look at. We're at 99.7 for all measures. You can see back in the fourth quarter of 12, we were at 997. A little bit of a dip here had at least partially to do with the way things were graded or scored. They changed the rules and moved the goalposts a little bit for us. So as we've adjusted to that, we're back up to the 99.7, which is good, and we'd like to continue to improve on our quality, because these sorts of measures are what will determine how we're paid in the future. Hand hygiene. The physicians start to cringe now when I'm presenting at their departmental meetings, because they know that there's two things I'm going to bring up. I'm going to bring up CPOE, which is the computerized physician order entry, and I'm going to bring up hand hygiene. And so I constantly am emphasizing the importance of good hand hygiene to our physicians, because they're, it's something that's important right now. It's not something that's publicly reported, but I would imagine at some point it will be publicly reported. And I really would not want to have to try and explain why 60% of the time, only 60% of the time are we doing proper hand hygiene. So I emphasize to the physicians and to all the staff, it's just very important that we continue and be cognizant of it. And you can see how we have improved, and we want to continue to improve. The goal is actually 100%. And keep in mind, though, the more we do, the better. It's good for our patients. The Ebola has something to do with, it's good that the hysteria has kind of calmed down a little bit. We've been able to kind of take a breath, look at what we're doing. But we, as a health care organization, we have a history of taking care of infectious diseases, from SARS to H2N1 or H1N1 to HIV, all those sorts of things. And so Ebola is just another one of those that we have a history of being prepared for. As the CDC, they had some initial guidelines. As they changed the guidelines, we adopted them and adjusted. We've conducted drills for Ebola. We added the mandatory donning and doffing training for the personal protective equipment at the safety marathon. And we're working on getting the new isolation supplies as the standards changed. But it's something that will, it's important to know that we're as prepared as we can be. We will continue to follow the CDC guidelines. But it's, to a certain extent, it's similar to what we should be constantly prepared for, because we have patients that have potential for serious infectious problems all the time. HCAHPS, you can look at the slide here and see the different colors when you look at that. The most recent one is this shade of blue. And overall, it's improving. The communication with the doctors and the response staff are overall improving. We want to continue to watch those sorts of things. It's important to see that the recommend UH has improved. These are all numbers that we'd like to see better, as these are percentiles. So we obviously would like to continue to see them improve. When you look at these ones, pain management went up. These ones are always a problem. Communication regarding medications and discharge instructions. Those are things that we're always working on. And the important thing about these is that a lot of times the patients, we think we've explained something to them and they're just not catching it. And so that's what this tells me is that there's a lot of things that are going on. For example, when they're being discharged, that there's a lot of other things that are going on. And so we just need to continually to work on those, and those are ones that we want to see improve. Press GANEY, overall the scores are better on the inpatient and the outpatient side. ED has dipped a little bit. We would like to see that be better. As we go through the construction process, it's going to be a little bit of struggle, because patients, if they're inconvenienced, if they have to walk farther than they wanted, they had to wait longer than they wanted, those are the sorts of things that a lot of times they'll take out on a survey, but it's something that we continue to need to work on. Then we look at first care and ambulatory surgery, nice upward trends. And then the new patient portal. As part of what's called meaningful use, the government wants us to go towards more electronic medical records and having patients have access to their records wherever they are. We do have a patient portal which provides access for the patients to their information. We want to encourage the patients to sign up. They need the medical records number and their email address to enroll. The email address has to be on file on Meditech, and they can access it through the Union Hospital's webpage. Right now, they can get some of their labs and some of their other information. It's important to keep in mind that as we go forward, the patients are going to have more access to their records. So you never really want to put anything that is derogatory in the record anyways, but now, in context, the patients may not quite understand what you meant. As we go forward here, more and more they'll have more and more information that they're able to access on the website through their portal, and also through their physician offices. And at this point, I'm going to turn it over to Mr. James, and he'll do his section.
I'm going to start with the financial pillar, and if you'll notice up here, we've billed out in the first 9 months $172 million. And you can see $120 million of that is the outpatient world. And if you were here several years ago, it hadn't been that long ago, when about 50% of our market was inpatient and outpatient. We are becoming much more outpatient dominant, like all community hospitals. We've discounted off another $92 million. That $92 million includes the discounts for the insurance agencies, but it also includes bad debt and charity care. One of the things that I have been told is that since we started doing the Medicare expansion, our actual bad debt and charity care is going down. So that means that some of those patients that we were seeing before, that we were doing the care without getting any kind of reimbursement, we are getting some now. So after all that, we've got about $80 million we've brought in, and then we've got some other sources of revenue down here. And I used to tell you that other source of revenue was primarily the rent that we get from the doctors in the medical office building, and the food that people buy in the cafeteria. Well, actually now about half of that amount is the meaningful use dollars. That's where we put that information. So that's down there. So we've brought in about $83 million during the first 9 months. How we've spent that is about $42 million on salaries and benefits, $31 million on supplies, services, and the other things that we use to take care of patients. And then finally, we've got about $7 million of the fixed things. That's the insurance and interest expense, depreciation, all that. So when all said and done, we've spent about $81 million, and we've got about $2 million left over, which is a 2.5% operating margin, which is about average for a community hospital our size as we look at as we benchmark against other hospitals out there. Now, one of the things we do like to look at is volumes. And if you look at our volume since 2008, which was our peak year, it's been a steady decline. That's pretty consistent with what you see along most community hospitals. This year, however, you can see that our actual admissions have plateaued. We're actually a little ahead of where we were this time last year. And that's the first year we've done that in a lot of years. I'd like to tell you that this is the bottom, but I can't be sure that this is really the bottom. And as you see, the patient days are actually going down. So the length of stay's gone down during this period, so we're actually seeing less patients. If you look at it as an average daily census, if you were working here in 2008, we had about 80 patients in the bed any given day. Now we have about 60 patients in the bed. Now, for any of you that are working on an inpatient unit, there are some outpatients up there. We call them observation patients. They're in the bed. I've been using the term their heads in the beds. The concept there is that several patients that we have who are actually treated like inpatients on an inpatient unit really are outpatients. So their revenue shows up in the outpatient side of the world. So that 60 may be slightly understated. Those are actually people that are counted as inpatients. This is where our growth is. ED and outpatient registrations. If you look at outpatient registrations, in the first 9 months, we've had almost 200,000 outpatient registrations, so 200,000 different tests that are going on. This is the reason we're buying the new, or building the new ED, is because that's the area we know where we're going to see a lot of volume growth. Surgeries and deliveries. Deliveries is the green line up there. If you had been here 3 months ago, I was kind of panicking because that number had dropped down there. I was saying, are we losing market share? What have we done? Well, for any of you who may work in the OB unit, we've actually had a busy last quarter. They've picked up and are actually back at about where they were for previous years. So we'll probably end up ahead of 700 deliveries, which is what we do in a typical year. Surgeries continue to go down. We think that's probably as economically motivated as anything. More times that people have to make a decision to put their money into it, and it's an elective admission. It's not something that's required. They're putting some of those things off. So one of the things that we are seeing is it's the end of the year. Fourth quarter tends to be our busiest quarter. Last year, we did as many orthopedic surgeries in the last 4 months as we did in the first 8 months. For those of you who've been around a long time, I remember when we first started out, between Christmas and New Year's, hardly anything happened in the hospital. Now, between Christmas and New Year's is probably our busiest surgery week of the year. As a matter of fact, some people get upset because they're trying to get in before the end of their deductible year and are finding out that maybe the doctor's already booked up for the number of surgeries he can do before the end of the year. The emergency center, that continues to be one of our big things. We had the groundbreaking on August 25th. I'll show you a few pictures here in a few minutes about that. But we've actually started phase 1. Phase 1 is building the Great Wall around Mount Union. Okay, we're putting all the dirt in there, and there's that wall. Now, I hope you've gone out there and seen it. It was supposed to be one big concrete wall, and then what they're using is blocks. So they're developing these blocks, and it gives a little bit better texture. And mark my words, sometime in 2016, that will be the climbing wall for kids in Dover and New Philly. You know, at some point, that's just going to happen. What you'll see next is we'll begin to get ready to close off the helicopter pad area, and the temporary pad area, and move it. And then we are not going to start digging the hole in January. The parking lot component will be finished by the end of December, but we're going to take 2 months off. And I always tell people, when you stop construction for 2 months, people immediately say they ran out of money. Well, we didn't run out of money before we started. We're doing that for 2 reasons. One, it'll be easier to start in March when the ground may not be quite as hard frozen. And secondly, because we're taking a lot of parking lots out of service, it gives the employees a little bit closer parking in January and February, and then we kind of back you up coming to the spring. This is the emergency center parking issues. This is where that temporary lot is going to be over here on the left. So that parking space will go out, and I read in stat sheet that we're actually going to take it out and stripe it, get it ready to go. I'm not exactly sure when they'll actually start beginning to land the helicopters over there. But this fence will, on the right side over here, will probably start around the 1st of March. That'll take out a lot of the parking spaces. As I've said all along, we're going to lose about 60 parking spaces through the whole project, which isn't a big deal because we have more than 60 parking spaces we can give up. However, we're going to lose about 160 parking spaces during the construction, and that's going to it's going to be a little tight for us. We have started the valet. The valets just changed their hours. Originally they were 9 to 9. They're now going 11 to 11. Found out they weren't parking very many people in the morning, but people, when they left at 9 o'clock at night, there were still a lot of unclaimed cars that they had to work on. So they've shifted their 12 hours. The benefits changes are being announced in a benefits fairs, so I urge you to go to one of those sessions that Tina is conducting. They go through the rest of this week. There are no major changes in our health plan design. There are some changes in the dollars that relate to the health care. How our premiums are set are based on last year's experience, so depending on where they are, some of those premiums are going down, some of those premiums are going up. We're moving to a different dental administrator, and we'll have a higher maximum. I think the current one is $750. The new one will be $1,000. It's a passive system this year, therefore if you don't want anything to change, you can just leave it alone and it'll automatically roll over to next year. However, if you have a flexible spending account, the government says you have to fill that out every year. That's not a union rule, that's a federal rule. So you will have to fill that out. Federal government's also made a couple of other changes. They've upped what you can put into your health spending account if you have a high deductible plan. Also, if you're putting money in the 403B, that maximum is moved up from $17,000 to $18,000. And if you are over 50, you can put away another $6,000. Now I think that's up from either $5,500 or $5,000. Please go to the session. I did a 60, 90-second flyby. Tina does a full presentation, tell you all about that sort of stuff. So it's much more informative. Tech program started last week. This is a program where every year we have tried to entice some of the students in the school systems around the county to learn about healthcare jobs in hope that they will go into healthcare and come back to us in an experience. We've had over 100 students, or hundreds of students, I guess it's probably several hundred at this point. This year I think they're going to do it as on 3 different weekends through the year, as opposed to doing it in one weekend or every month as they've done it in the past. So it's a new formula. Even though they started last week, Holly has told me that if you know teenagers that want to get involved in the program, go ahead and contact her and she can work them into the program. One of my favorite things to do every year is go to the service awards. It's always kind of fun to see who have been here for how long and who started at what. So these are just some pictures from the annual service awards. These are 4 of the 6 people from 25 years. This is what I call the high-low picture. Roger and Carol were the 2 people that were there that were celebrating their 30th year here. Big group in 35 years. We had 10 people that were celebrating 35 years, and several of them showed up at the service. And finally, the 40-year folks. And I do say that some folks come here and stay for a lifetime. And so, when you look at them, some of them must start as a teenager. Well, I did look it up, and Paul really started when he was 17. So we're laughing about that. Now I've told you Paul's age. That you've actually got some of these people who come here, and I tell the new employees when we're starting out that we have people that are here for a long time. And speaking of people who've been here a long time, Mary, this is from the ED groundbreaking, and of course all of you know Mary Hamilton, who we recognized earlier in the year as our nominee for the OHA Healthcare Worker of the Year. And Mary went on to be one of the finalists in that. And then we let her throw the first pieces of dirt out for the new ED, since that's where she spent the majority of her career. And then Mary, not to be outdone, has become the Tuscarawas County Woman of the Year for 2014. Give Mary an applause. The interesting thing, though, is Mary did not win this an award because of Union Hospital. Mary won this because of her work with the trails. Many of you might not know, on her spare time she takes chainsaws and a bunch of teenagers out and forces them to clear trails. So that's what she was nominated for. The lady on the left is Connie Fenton. Connie Fenton is one of our auxilians here at the hospital. Her big project is every year is the Tree Festival, which of course we did the preview party on Friday and is now running through this weekend. She's done that for 21 years. She obviously is involved in a lot of other things, but that's the big project that she does. And she's a former a former Tuscarawas County Woman of the Year, so she was there as well. The person giving up the 2013 Woman of the Year is Lois Andreas. Lois is one of our board members and was recognized in part because of her work with Union Hospital. So the women at Union Hospital have had a rich history of the Tuscarawas County Women of the Year. This is Mark's Place, beautiful 10K event, Healthy's Beautiful 10K event. This is a program that is run to raise money for people who have movement disorders. As a matter of fact, the group's called Movers and Shakers. Primary diagnosis you see a lot of times is Parkinson, but it's any movement disorder. They raised about $85,000 from this run. In the previous years, what they've done is they've given us money to educate our staff on dealing with people with movement disorders. As a matter of fact, the type of program we run is the only one between Columbus and Pittsburgh. It's a fairly sophisticated program. And then any of the patients that go into these movement disorder classes, regardless of their level of work, they never have to pay a dime because these people are paying for their care. Paint Tuss Pink, Breast Awareness Month is October. Breast Cancer Awareness Month, and this is everybody in pink here, and the Dover Key Club also got involved in it. Some of the teenagers here raised $2,000 to the donate to the Mammography Center in support of breast cancer awareness. So, in summary, we continue to get a lot of awards, and we're very proud of that. We had good quality scores, good patient safety. I also have to remind everybody to keep washing hands because that's one of our big initiatives that we're working on. In general, the patients who came to see us during the third quarter felt that we were doing a little bit better on our customer skills than we've had in the past. We're kind of ahead of where we were last year in this type of financial system. And finally, the ED parking improvement as part of the Lauren Emergency Center project is underway. Any questions that I can answer for anybody?